Who's next? Todd in Lawton, Oklahoma. Great to have you on the program, sir. Hello.
Thanks, Rush. This is kind of like a combination of Christmas and my birthday, but rolled into one. But I'm trying to get through for a long time. One quick comment on the Verizon blogger guy. Just imagine what he's going to feel like when he realizes he can't opt out and go to another provider of insurance, like what's going to be under Obamacare.
Well, that's a great point. That is a great point. All of these young people have a massive educational awakening ahead of them.
I would just like to kind of dovetail that into my wife's got MS, and she currently has good insurance. It continues to go up, and she has to have it, obviously. We looked when they floated a trial balloon about what the affordable, in quotation, pre-existing condition stuff's going to be, and right now our premium is around $600 plus. You got deductibles, but I believe at that time in Oklahoma it was going to be in like $980 a month. And then we looked at a list, if you know anything about the VA system, on the drugs that are covered. They don't cover any of her treatments or drugs that she's going to need. So we'll get to pay a lot more to get basically nothing in return if and when private health insurance is driven out of business, which is the design of this law. What do you think?
Well, I'm having trouble hearing you because you're on the cell phone. It's not your problem, it's mine. Did you say something about pre-existing condition in there?
Yes.
Okay, because if you did, what people are discovering as some of those who are getting through and being able to set up their accounts at healthcare.gov, they're finding that the deductibles are like one example, I saw a $5,000 deductible, and the premium to get enrolled with a pre-existing condition was $13,000. Now I forget what the condition was, but my point, a lot of people who are going to be accessing this, I am sure, are expecting it to be either free or not cost them much at all. That's what they mean by being insured for a pre-existing condition. It's kind of
exactly.
like
it's unaffordable to go have a house burned down and then go buy insurance for that house.
It's like our little tech blogger. It's like our little tech blogger who thinks his wireless coverage ought to be practically free. And the way they have sold this pre-existing condition business, the way the Democrats and Obama have sold this, is that they have said to people who can't be insured because of pre-existing condition that big insurance is shafting you. And your example is right. If you can go buy insurance while your house is burning, we're not talking insurance, we're talking welfare. This isn't insurance. This was simply a sales gimmick that the regime used in order to appeal to people who think that they're being victimized by an evil capitalist insurance system. And now they find out what it's going to cost them to be able to be covered with their pre-existing condition is one of the biggest, it may be the mother of all October surprises, as you have encountered yourself. It's not a pretty picture. I appreciate the call. I got to take a break. Thanks much. Back after this, folks. Don't go away. So Todd in Lawton, Oklahoma, what he was basically saying was his wife has MS, and their rate is going through the roof, basically. And that was not expected, obviously. Nobody's expecting what is going to happen. Now, I want you to remember the regime ended enrollment for the pre-existing conditions program back in February. Do you remember why? They ran out of money for it. It's called the High Risk Pool Program. High risk is the legalese for pre-existing conditions. And they ended enrollment even before it gets implemented because they ran out of money. They ran out long before they thought they would. They thought they had funded the program for an adequate number of years, and they're already out of money. They've ended enrollment. If you didn't get in on it, you are up the creek. Now, just imagine what this is going to do to the private sector insurance companies who cannot print money, which, of course, is the intention. It's basically to shut them out. And all of this it'd be wise to bear in mind that the real purpose of all this is to simply deal a death blow to private sector insurance so that your options there are so limited to non-existent that you have to go eventually to the government, because the end of the day objective for Obama, the Democrats, and everybody who believes in this is single-payer, government socialized medicine. That is the dream. And that's what they're on the road here to